Hi, this is Dr. Nate coming to you from Proactive Healthcare. Got a great video today. This is one of the most common things I see with a lot of patients is either knee pain is their primary thing that brings them in, or they've had knee pain for years and years and years and just never got rid of it. They did therapy, they did injections, they did all sorts of stuff, but never really got into it. So one of the first things I go over with my patients is, we don't always go towards the exact spot where they have pain. That's a concern, but that's usually telling us that the body has an issue and is looking for a change. It's usually the brain reaching out to you saying, you need to fix something, whether it be the knee or whether it be a bunch of areas connected to the knee too. So, seldomly do we find that the knee is the only problem, especially if you want to get long-lasting, relief from the knee pain or get that thing stable like it once was before an injury. Speaking of stability, uh, look at this chart real closely, and every other joint is either a mobility joint or a stability joint. So it starts with your big toe. Your big toe should be mobile. We talk about that in another video, but your big toe should be able to go up and down and extend. And if it doesn't, then that usually leads to bottom of the foot being, which should be a stability point, ends up being more mobile, and then people develop flat feet, they develop plantar fasciitis. But if we go up to the next joint, your knee, or sorry, the next joint would be the ankle. That's the one we're going to kind of focus on today. But the ankle should be very mobile. But unfortunately, with the shoes we wear and old injuries, sprained ankles, twisted ankles, all the different injuries we've had that we never fully rehab from, never fully got our sensory maps fixed down there, never fully got our muscle memory or muscle movement maps fixed down there. Our brain doesn't feel stable with the ankle, and so it doesn't allow it to be as mobile as it should. So then there's a concept where, if one joint is not mobile, then the body's going to make another joint above it or below it hypermobile. And usually the joint above and below it is a stability joint, which shouldn't be, or it should be more of a stable joint. So the next joint up from your ankle would be your knee. And you can see from the chart there, that's a stability type joint. It really is just a hinge. It should flex forward and extend back. Um, but when the ankle is not moving well, you start to get transverse movements in there where the knee doesn't like, it's moving in a direction that it's not designed for. And that leads to knee pain. Same thing with the hip. We're not going to go over that in this video, but in another video we will. When the hip is not, as mobile as it should, then it leads to hypermobility in the knee below it. So three common causes of knee pain. We're going to look at these as tight psoas muscle, a fibular bone subluxation, and then the biggest thing, like I said, is restriction and hypomobility in the ankle. So psoas muscle is a muscle it's actually connected to the front of the lumbar spine, and it comes down through the pelvis to the top of the top of your leg there, and it brings your leg up and in a bit. And that can be very weak. It can be very tight. So if you get that tight groin pain, you might think it's a knee or a hip problem, but it's probably a tight psoas. So I'm going to show you a little
So one of
video
the
here.
stability muscles for having no knee pain is the psoas muscle. It's a muscle that is attached in front of the spine, in the lumbar spine there, but in the front of it, and goes down to in the middle of the groin there, the legs. So a way to test this to see if you're strong is you lean up against a wall if you don't have very good balance, or you can do this off the wall. But bring your knee up to just above your hips and hold it for 30 seconds. And we're seeing if you can do that. And if you start to shake for the 30 seconds, somewhere in there, and then bring it down, and now do the other leg. Bring it up a little higher, and hold it. So that's how you can test the psoas muscle standing up.
So you can see that there's an easy little test you can do at home. Just, if your balance is good, come off the wall. If your balance isn't good, just put one finger on the wall, lift your knee up just above hip level, and see if you shake more on one side. See if you have trouble even getting it up there. A lot of people can't even get the knee up that high or even hold it that long. So look for future videos on how to strengthen the psoas muscle, but that's a
So
key. contributor to it. The other thing is the bone that's on the side of your bottom of your leg there below your knee. That gets jammed or subluxated, what we call it, up in the top mostly. It gets jammed up and it gets jammed back. So an easy test you can do is kind of go to the outside of your knee, right behind it, and push forward just under your knee there. And if that's tender, it's probably jammed and it's probably irritating the peroneal nerve down there. And so what happens is, when you start to like go up uneven surfaces, go up stairs, it jams in that knee and can cause knee pain because down below at the bottom of the ankle, because it's pushed forward. So if this goes back, then the bottom of the ankle goes forward. That part of the bone by the ankle goes forward. And so as soon as you dorsiflex or extend your ankle back, it jams in that joint and then refers up and then irritates that nerve up there too. So a simple test you can do for that is just stand with one leg out in front of the other and then bend your knee and see if you can get your knee at least 4 inches in front of your toes. If you can, then it's probably moving and mobile like it should be. But if you can't, then that means that joint is jammed and needs to be worked on. And then the biggest thing is testing the ankle instability. And how we test that to see if it's an issue is we test your hamstring. So I got a little video here on how you can test your hamstring strength and then also test how strong it gets
Hi, this is
afterwards.
Dr. Nate coming to you with a condition that I see a lot of. It's knee pain, hip pain, even ankle pain. And I find a lot of my patients, they just have no mobility in their ankle because of the tight shoes they wear, the skates they wear, the tight soccer shoes. This is my daughter Haley. She plays soccer all year long and been dealing with some knee pain. Only comes on when she's playing soccer. So we're going to look at why that is today. So the most common thing I find and the most common thing we treat people is locked up immobile ankles here too. There's joints all around there. When the shoes compress on that, the joints don't move. And there's a concept that they're finding in research a lot. When one joint is immobile, another joint will become hypermobile or move too much. So that's why a lot of times you'll get knee pain or hip pain. But if we can get the problem fixed down here, the knee pain and hip pain goes away with a lot of my patients. So I'm going to test her. Easy test you can do at home is lay on your stomach like this. If you don't have a table to lay face down, you can just put your arms up like this. I take and put my hand right here above her, right below her calf and above her ankle, and I'm going to have her bring her heel to her butt. See how weak it is? Try again. The hamstring should be one of the strongest muscles in your body. We'll do the same thing here with her left one. Butt, and right back down. Alright, so now I'm going to show you, we work on this in the clinic, but just some mobility in her ankle. I'm just going to open it up a little bit, not even putting that much pressure on there. I'm going to do the same thing, bring your heel to your butt, and super strong. Relax that one. Let's do the same thing here. Open up right under that big bone on the side there, right on the inside one. Open up talus, navicular, calcaneus. Again, bring that heel to the butt, and super strong there too.
So you can see, I'm sorry if the video was kind of quiet. I just noticed that there too. But it's a simple thing. You just lay down. If you don't have a table, you can kind of put your arms up underneath your chin so your jaw and nose don't hit the floor. Just have somebody kind of put your hand right at the base of your ankle. I always aim the thumb this way in case they really try to use super strength and jam your thumb. And then just brace with one hand right on the pelvis or the lower back there and have them resist. So bring the ankle up to about this angle, not quite 90 degrees, but right through here, and then push down as they let them start to pull up first, and then you resist it, and you'll see how weak, especially a lot of times, with my daughter here, you saw she was weak on both sides. Then I did a little mobilization of the ankle. That's a technique that we do in the clinic here. But you saw me just doing that, just a little bit of mobility there made her stronger. The problem is if I do the mobility, it doesn't create that muscle mapping that your brain wants. It doesn't re-educate your brain. So as soon as she gets up and walks down the hall and back, it's going to go back to being weak because I did and she didn't do it. So we teach our patients, we teach people how to do it themselves so that it does hold that memory, and it does get the longer lasting hamstring strength and mobility in the ankle. And then I just find that these knees improve from there. All right, here's another little video just kind of showing you a close-up of the spots that we work on for mobility with the ankle.
So I want to show you a model of an ankle and the importance of the mobility in the ankle. And that's one of the things we really focus on with our patients is being able to move that ankle in all the different directions without pain. We talk about a concept called arthrokinetic reflex. If any one of these bones, these little bones in here, is not moving well, it creates an immobility in the whole joint itself, which then leads to weaknesses up the chain or up the leg to the knee, to the hip, and even the low back. So we find a lot of times people have knee problems because of lack of mobility in the ankle itself. You can see some of my dots have fallen off, but you got your two bones on the side of the ankle right here, the lateral malleolus and the medial malleolus. And then you got the fibula bone right here. And in a different video, we showed you how that gets jammed up here right below the knee. And if it's jammed up and back, when you go to move, it kind of jams down in here. And so one of the tests we do is bringing that knee out in front of the foot to see if it's hurting down there or up on top there. But when we do rehab here, we work at getting loosened these joints here. So we have you do some lateral ankle pulls, we do some medial ankle pulls, and then we flip that foot over and do what we call toe pulls on 3 different areas. Right in front of that bone on your inside of your ankle, right on the outside and just in front of the bone on the outside, and then right in that little tender area, if you go right down your leg, we do ankle pulls like that. It doesn't take much, you just got to do it in each direction a few times with just a little bit of a bend of the knee, usually the front knee as we do it. And lo and behold, every time we test the hamstrings afterwards or the psoas muscle, it's usually almost always stronger. The problem is you have to do it yourself because it's a muscle memory thing, a muscle mapping issue with your brain. So if I went in there with a patient and just started mobilizing and pushing it, they might get some relief, they might get stronger, but as soon as they walk around down the hall a couple, you know, even down a half a block, that thing is just going to lock back up and you're going to get the weakness pattern again. So we definitely educate our patients to do it themselves so that their brain can feel the movement, can see that the ankle is moving in all those different directions, and then they get longer lasting, not only mobility in the ankle, but then I find knee pain goes away, hip pain, and even lumbar spine pain goes down, or the lumbar starts to move a lot better.
So yeah, I mean, look for some future videos from us. Like I said, the joint that should be mobile below the ankle is the toe. So we're gonna, I'll do a video later on that one on increasing that, and then also the mobility in the hip. And sometimes it gets less mobile and sometimes it gets less stable. So look for more videos as we go along, either on our YouTube channel or we'll post them on our blog page. But if you have any questions, stop on in. We're in the Skyway of the U.S. Bank Building downtown St. Paul. Otherwise, email me. I'll feel free to send you exercises and mobilities for the ankle. So yeah, thanks for watching the video, and we'll talk to you soon.